it's a built-in sense of security. It's a built-in sense of ability. So I like glasses. I have, lots of friends who are optometrists. I look at their frame boards. I love the glasses. It's not that it's an issue with glasses. It's more like I have to wear it in order to live my life. That's the issue.
This is Dr. Meenal. Welcome to Uncover Your Eyes, where we uncover reality. As a mom and eye doctor, I want to know it all. Self-esteem, body image, definitely things that affect a young girl's life. And for me, it was my thick glasses that affected my confidence when I was younger. I was a -10 with some astigmatism, and I wore thick glasses. At that time, we used to call them Coke bottle glasses. Even with the thinnest lens options available, they were still very, very thick. And I was teased and called names like Four Eyes. And it really affected my self-esteem, my confidence, my body image growing up. As I got older, I delve into my books and sort of became that stereotypical nerd to shy away from all the comments and the world. And knowing in my teenage years that I couldn't really wear contact lenses because they weren't made in the parameters that I needed them in really broke my heart. So I continued to wear these Coke bottle glasses. And at that time, if you guys remember, silhouette glasses were really in. Those were the rimless glasses without a frame look. And my glasses looked even thicker because there was no frame covering it. And obviously, I wanted to at least wear the coolest type of glasses at that time. So as I entered optometry school and I graduated, I learned more about LASIK, and I started working in the industry and realizing that glasses were actually hindering my day-to-day life, as I would constantly have to look at patients' eyes through what we call a slit lamp, the microscope with the oculars. And my glasses would always bang on them every time. And so I decided, let's try going for a consultation and considering LASIK. And I'd like to tell you that I've successfully had LASIK now with my high prescription, and it has changed my life. Not only professionally, but also in terms of my home life. Being able to see my kids in the pool, being able to wake up and not having to reach for my glasses at the bedside and just being able to see them right away, and being able to go out, walk around, take them to the park where I'm not dependent on my glasses or contacts is huge for me and has really changed my life. It has also built my self-esteem, knowing that I'm not masked or hiding behind my pair of glasses. Now, as time has changed, there are contact lens options available in my prescription parameters. So looking back, would I have considered LASIK still? I don't know. But what I can say is that it has changed my life, and I would not go back in time and not have the procedure. So I'm really, really excited to introduce our next guest. She was the doctor who helped me through my LASIK process and actually did my consultation for LASIK. So we have Dr. Kerzner, and Dr. Kerzner is the Optometric Director at TLC Laser Eye Centers, Toronto. She is originally from Montreal and graduated from University of Waterloo School of Optometry in 1993. She began working when PRK and LASIK were first being introduced as a novel vision correction option to the world, and she immediately fell in love with the field. Since then, refractive surgery has evolved in terms of technology and scope, and Dr. Kerzner has dedicated the last 25 years participating in this evolution. Welcome, Dr. Kerzner. Okay, so welcome, Dr. Kerzner. Thank you for being on today.
Thank you so much for having me. It's amazing to see you.
Thank you. So, tell me, why did you choose to get into laser vision correction or the LASIK field? I mean, I know you've focused the last, 25 years of your career on purely LASIK patients or other forms of laser vision correction as well. But why? Why this field?
You know what? It starts really why optometry, and that is because I always knew I wanted healthcare. I like the sciences, I like the biological sciences, um, and I really wanted to do something that was people facing and that helped people. And after I graduated, LASIK was just coming out. It was 1993 when I graduated, which is when LASIK was launched commercially. And not only was it helping people, but it was freeing people. And it was a new technology and it was so exciting. It was all the early adopters. And it was just an amazing coincidence that I happened to be looking for a job right when the industry was starting. And it's just a perfect fit. I never left. I thought I was going to try it for like 6 to 12 months and just see, if I was coming in
Yeah.
and walking on eggshells every day. But it was so gratifying that here I am, like 28 years later.
So why do you why are you pro LASIK? Why would you want to even recommend LASIK to patients coming in who are potentially good candidates?
Sure, it's very freeing, as I said. People don't have as much of a resistance to glasses as they had maybe like 50 years ago. The styles are so fashionable, and even
Yeah.
post
I
LASIK
was one of
patients.
those, by the
Ye-
way. Yeah. Where I'm like, I don't know now. I wish I could wear a pair of glasses,
People
right? With
do.
funky
I have
frames.
yeah, no, I have lots of LASIK patients that, love their glasses more now because number one, they're not thick. They're not as expensive because they don't have to buy high index lenses. They get better sunglasses, they have more frame selection, but they're not dependent on it. It's not a crutch to do what they need to do in the course of their day. And it's really the independence and the functionality and the ability to get involved and really live your best life that I've seen over and over again. I think initially people think of it as cosmetic surgery, but patients don't talk about that. Maybe contact lens patients talk about that, but LASIK patients talk about the ability to just like jump in the pool, to just, you know, sail, to horseback ride, to do things that their glasses and their contact lenses held them back from. And so it is an elective procedure. If it doesn't speak to a person, I'm not, a hard salesperson. It's something that you have to feel, is going to speak to you. But
Right.
so many patients speak to you. It speaks to so many patients.
Yeah, yeah. I love the words you used because I feel like they fit perfectly with me is independence and functionality,
Mhm.
right? And the pool thing exactly, just seeing my kids in the pool, right? And I was a minus 10 before, as you know, before I had LASIK, and just seeing them, being able to function without contacts and glasses is amazing. So I'm sure in your career you've encountered like so many patients that have had great stories or are so happy they had it. Do you remember a time when there was a patient that really resonated with you and you felt like, oh, thank God he had it successfully or she had it successfully?
So many, too many. But I'll just touch on what you touched on about your children. A lot of patients, that's like one bucket of kind of patient that I see is patients who are new parents because if they were hesitant to either jump into the surgery financially or just out of fear when they have their kids, especially when they first take them swimming. That just pushes another button. And they do it because they really want to be able to feel safe for their kids, even if they were in an emergency situation or they woke up in the middle of the night and they had to, like, get to their room. So that's actually a very common story. But other very common stories are people who are doing it for the police, the fire department, the military, lots of people who need the surgery for their career aspirations. But one of the very first patients that really, because I'm not a myope or a hyperope, I'm emmetrope.
Right. So you don't
Uh,
feel sad for us.
I don't think I really could empathize until I heard a lot of the stories. And one of the very first ones that really struck a chord was there was this very regular guy. He was fit, he was young, not like a vulnerable type of person. And he went on vacation with his family. He went into the ocean. It was like a beach vacation, and he left his prescription sunglasses on his beach towel because he didn't want to jeopardize a wave, washing them away. And there must have been an undertow. And when he came out of the water, he was in a very different place than where he went in. And all he could see was like a sea of colored beach towels, and he couldn't find his family. And his family couldn't find him. And it was a crisis. Like they had to call the lifeguard. And he said, it was so embarrassing and it was so scary for me that I made the decision right then, right there. And so that's what really struck me is like how um, it's a built-in sense of security. It's a built-in sense of ability. So I mean, I like glasses. I have, lots of friends who are optometrists. I look at their frame boards. I love the glasses. It's not that it's an issue with glasses. It's more like I have to wear it in order to live my life. That's the issue.
I love the built-in sense of security. That's exactly, for me, it's of course built-in sense of security. And I think also a built-in sense of self-esteem for me. I don't know, self-esteem, confidence. Do you think, I mean, there are people coming in, maybe in the 20s and 30s age group who want to do LASIK for their self-esteem and confidence? Like, is that really a reason people come into you?
Yeah, for sure. I mean, a lot of those people will choose contact lenses as well because it gives you the same cosmesis. You're without glasses on your face. But yeah, for
Mhm.
if you don't want to, mess with the insertion, removal, cleaning, replacement. And, some people are contact lens intolerant or they've had a few bad experiences and they don't want to go there. But yeah, no, definitely there's that aspect of it for sure.
For me, like when I see patients and, I kind of know there's that LASIK candidate, it's, when they've had a history of ulcers, like you said, right? History of ulcers, or if there are just not enough contacts available, or that parameter is not available for their prescription, that's really difficult too. So those are some of the top two where I'm like, okay, laser vision correction is an option for this patient. Um, I have to share this story with you that I have a young patient who's probably 13 or 14, and she is a -8 or so right now. So she's very high, but she's like desperate to do LASIK. So every year she comes in, she won't wear contacts. She's scared to touch her eyes. So that's another reason a lot of people want to have laser vision correction. But she comes in every year, like literally begging me, to have LASIK. And I think the standard age is generally around 21 and over now. So, I'm always waiting and saying, we have to wait for your prescription to stabilize, your cornea to stabilize. But poor girl, like for her, it's self esteem. Like she really feels her -8, glasses, no matter how thin she gets them or the thinnest option available, there's still, kind of a security issue or a confidence issue, body image issue. So,
Yeah.
what do you find is the hardest part of your job? Like, I mean, you are dealing with, I think, healthy people, I'd like to say, healthy, relatively healthy people who are coming in optionally to see you. It's not a force where, oh, they got to go for an eye exam. They want to come and see you. They
Mhm,
want to consider this
mhm,
and they're healthy. Right.
mhm.
So, what are the issues? Like for me, I look at that world and I mean, I've worked in it, but I also, as an outsider, are like, oh, she has the best patients ever, the nicest that are begging her to have LASIK. But what are your side? Like, would you say that?
I do like the healthy part of it. I mean, that goes back to why I chose optometry. When I was in high school, I volunteered in a hospital. And it was because I thought I wanted to be a medical doctor, like a physician of some sort. And I had a very sad experience there. I was put on a chronic care ward and it just broke me. I just felt too overwhelmed by the illness and death and the hopelessness of it. And I said, "Oh my God, I don't think I could go to medical school. I can't even." And people told me, "Oh, you don't have to do that as your specialization. You can go to radiology. You can," but I couldn't even imagine doing it for 4 years. So, anyways, one of the key uh, pivots in my life was I was in a career counseling library and I was flipping through looking for other medical health professions, and I flipped open onto optometry just by chance, and it said optometry is the care of the healthy eye, ophthalmology is the care of the diseased eye. And that really spoke to me because I wanted to be in the healthcare field, but I didn't want to be around so much sadness and disease. So this is amazing because I do get to deal with healthy people for the most part and make them even better. So it is hard to tell a patient they're not a candidate. It's especially hard to tell patients they're not a candidate when the whole thing is elective.
Yeah. So what are the things that make people like, I mean, there must be 100 of them, but what are like the top ones that stand out to you that make people a non-candidate?
So the main reason why someone wouldn't be a candidate for LASIK is if they have an irregular cornea. An irregular cornea, which is the front surface to the eye, just makes them prone to not heal properly after the surgery. So we do lots of tests on the thickness of the cornea, the symmetry of the cornea. We look at the front of the cornea, the back of the cornea. And if it doesn't pass all of these very stringent criteria, we don't recommend having LASIK. Now, having said that, there are other procedures that a patient may be eligible for. And so we definitely will cover those with the patient. But it is a bit of a curveball for the patient.
Right. So tell me, like, in terms of after a patient has LASIK, I mean, there has to be patients who, are unhappy or have expectations. Like, so tell me about how do you set all these realistic expectations and how do you deal with that aftermath?
Well, hopefully, patients have researched the procedure, and usually they have friends or family who have filled them in a little bit, so they have a frame of reference. But when they come into the center, we do go through a full informed consent with them where we go over realistic expectations, and we also have written pieces that we give them. Um, but in general, patients just have to be patient. I think because the next day after LASIK, you're already able to see close to the bottom of the eye chart, if not the very last line of the eye chart. Um, People think, oh, I'm done. And they'll say, but this, but that. But the finer aspects of comfort and the finer aspects of quality of vision. So things like your eyes feeling dry or things like having some glare around lights, it's normal. Any time, any kind of eye surgery, any kind of eye injury will create some discomfort or glare or halos around lights until it's fully healed. So patients really have to think of the full healing period as about a 3 to 6 month period, not just 1 or 2 days. You can see great in 1 or 2 days,
Yeah.
but that patient's part is sometimes forgotten because I think even past patients forget about that. It's like having a baby. You
Yeah.
forget about the small things that were not convenient and you just remember the joy.
Yeah, no, oh my God, that was that. Yeah, that's so true. So, I mean, you must have had patients that are unhappy postoperatively. I mean, with whether it's their expectations or whatever. So do you remember like a patient in particular that would stand out or multiple patients that, are unhappy postoperatively or feel like they could, reverse time and not have LASIK?
Well, there's lots and lots of studies on the satisfaction rates after LASIK,
Mhm.
and they usually range between like 95 and 98. So, usually, what I quote patients when they say, what's the success rate? To
Right.
me, success is very difficult to like, are you talking about 2020? Are you talking about happy? Like, what are you
Yeah.
talking about?
Yeah.
Even 2030 or 2040, which is 3 or 4 lines from the bottom of the eye chart, but allow someone to drive legally without glasses. In my mind, is a success, but may not be what the patient's talking about. So to ask a success rate is a little bit ambiguous for me. But I think of satisfaction rates, and it's a 96% satisfaction rate, which I think is very respectable. I mean, almost anything. I mean, one of the best restaurants in the city would probably not have a
Hmm.
96%
Hmm.
satisfaction rate. So I'm very comfortable working in the field, but for the 4% that's not satisfied, that is real. And we, take our time and we work with those patients. Sometimes it's because their eyes are dry, and we go through lots of different dry eye strategies. Fortunately, that field has boomed in the past 25 years, or especially in the past 10 years, I would say. So there's lots of dry eye treatments. Um, And even, in terms of glare or halos, that's like another, potential reason not to be satisfied. There are a lot of strategies for that. There's eye drops that keep the pupils small. There's an enhancement or a treatment that we can laser just to smooth out a cornea, just to perfect the quality of the vision, because we have customized technology now. We didn't have that about 20 years ago. So not only does that customized technology reduce the risk of that happening, but it also can be used as a treatment plan for those patients.
Right. And what about, I know there's a lot of patients who, you tell them preoperatively, in their 20s or 30s, you're going to need reading glasses in your 40s. But I know a lot of them come back unhappy because they need reading glasses, and they kind of come back and say, well, now I need an enhancement, and, we can't enhance for a reading prescription. So what are your thoughts on those patients? Like, what do you tell them?
I think there's just as many emmetropes that become presbyopic who go to their eye doctor who are unhappy. So I think it's just like the bane of our existence as optometrists, having to say what presbyopia is over and over again to those, 45 to 50-year-olds. Um, but generally, patients are happy to be free of the glasses for distance rather than for near, for two reasons. One is because it's more of an intrusion when you're doing sports and you're out and about in different weather environments and you're moving than when you're sitting indoors and reading or working on the computer. And
Hmm.
second of all, it goes back to that safety thing, in that you can get over the counter readers if they're just plus one, plus two,
Right.
plus three, but you can't if you have astigmatism or you're basing it off of some kind of distance prescription. So let's say you're on vacation and you lose your readers. You can go to the gift store, even if you're in the middle of like the ocean on a yacht. You can, find a pair of plus twos, but you can't find your prescription glasses that way. So it is something to educate the patients about, but I still think it's a win.
Yeah. I like the 20 happy. I don't know if I ever thought about that, but that's so true, right? That it's not about the number. It's, who's going to ask you, are you 2015? Are you 2020? Are you 2030? Like, people don't talk about that, right? It's, are you happy? And that's
Yes.
and that's huge. Have you decreased your dependency on glasses? And I like to say that that's the goal of the surgery. I tell my patients, it's not to get you out of glasses completely. You will be happy if you're happy decreasing your dependency on glasses, and that's a win for you then.
And we so appreciate optometrists conveying that, because I think we live in a time where everyone is ambitious. And when patients read the eye chart, like in my office, in your office, in anyone's office, it's almost like a contest. Like if you can't get to the bottom, like they feel like challenged, like I need to get to the bottom.
Yeah.
And then that brings them in for an enhancement inquiry where they
Yeah.
want to ask about doing a touch up for a very small prescription, which in many cases is not what I would consider recommended. So if it's significant,
Right.
if the prescription is like close to 1 unit, um, or if it's super bothersome, okay. But if it's just because you're trying to be, you know, uh, trying to win some pot of gold because you want to get to the bottom of the eye chart and it doesn't really impact your day-to-day life, like what really comes to mind is a lot of the presbyopes, like the 40-year-old, 45-year-olds that are minus a half or minus 0.75, that reap so much more benefit being able to read longer and more uh, frequently without being perfect for distance. It's a fine balance between distance and near. So, yeah, that's an important conversation to
Yeah.
bring it back to the real world, not just like some arbitrary line on an eye chart.
Right. You know, you mentioned something about technology, and I want to touch on that because I have heard your verbiage around technology, and I think it's phenomenal. I've stolen some of your words. So, can you tell our listeners, like, first of all, is technology is important, of course, but and that's obvious, but how is technology important? Like, what are the advancements that make it important? What should people be looking for in terms of technology at the center that they choose to go to? Is it customized LASIK? Like, what are the words and what should they be looking for? And why should they be getting custom LASIK versus going, down the street and getting LASIK done for very cheap?
So there's two steps to LASIK. One is to create the flap, and the other is to sculpt the curve of the eye. And both of those steps have been innovated in the past 15, 20 years. So to create the flap, you can use a microkeratome, which is a bladed device, or you can use a laser.
Okay.
To be truthful, they're both good instruments. I prefer a laser. I feel there's a little bit more control over the reproducibility of the flap. So the thickness that you get and how even the thickness is, which I think is an advantage because you know what you're working with. But that's not to say that I haven't seen many, many patients who have a microkeratome flap and they have a great result. So there's always more than one single answer, but people have their preferences. So I recommend laser to create the flap when possible, and custom technology or topography guided technology or wavefront technology all speak to a prescription is just a portion of the reason why vision is blurry. There's
Right.
other components that make vision blurry, and if you can include that into the treatment plan, you're going to be aiming for even better quality of vision, which usually is noticeable at night when the lights are low and our pupils get big and we're more at the mercy of the optics of our eye. And so I think it's a good idea to stack the cards in your favor and have a customized treatment because it's available. Again, not everybody needs a customized treatment because they may have a very symmetrical cornea,
Mm-hmm.
but you never know what is you know, the two sides of outcome. So why not use the best technology possible and stack the cards in your favor? It's almost like wearing a seatbelt in your car. You don't always have to wear a seatbelt. You could probably get from A to B safely, but you never really know. So why not wear it just in case?
Yeah. Yeah. No, that's great. So tell me, like, customization. What does that mean? Like, are you lasering 5 points on the cornea? Like, what exactly does that mean when we say custom LASIK?
So there's such a thing as a topography of a cornea, which is like a curvature map. It's imagine it like you're in a helicopter looking down on the relief of the ground below you. So we have this relief map of the cornea, and some corneas have a bit of a asymmetry to them, a bit of a tilt, or they have a high spot or a low spot.
Mhm.
And so when you can map that out, you can laser individual spots. It's not just when you're wearing glasses, it's really just a very smooth curve that you're getting across the field of the glass. But when you're doing a laser pattern, you can pixelate it. And if you have the topography map and you address all of those points individually, you're going to get a better answer to why the patient's having blurry vision.
Right. Would you compare it, like, I like to compare it to TVs. Like, back in the day, we were very happy with our older TVs. And now I don't know the words around technology, but now I guess they're more pixelated or HD or whatever. And now we love it, but we would never now go back because now we know what we
Exactly.
can have, right? Yeah.
Exactly.
Yeah. So, when you were talking about the flap, you had said that, we can make it with the laser, obviously. That also makes it thinner, right? So we are taking off less tissue if we're making it with a laser, correct?
Yes, you usually
Usually.
you can set the settings to different things, but when you are aiming for a thin flap, which is what we do, we spare tissue, which is advantageous. It gives us more room for prescription treatment. But you can set the laser to a thicker or a thinner flap. You can set the microkeratome to a thinner or thicker flap. So it's not always thinner or thicker, but typically people agree that the laser makes a more reproducible, predictable flap. And so you have a little bit more control over its architecture.
Okay. That makes, yeah, that's, no, that makes sense. So I and I'm sure a lot of other doctors get a lot of questions around, when we do bring up LASIK or laser vision correction, well, no, 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 I read that article or I saw this video on TikTok where someone was, debilitated, whether it's with dry eyes or mental health issues, right? We'll see like depression, anxiety, post LASIK. Can you, I mean, I know you can't speak to everyone, but can you speak on it a little bit and what your thoughts are around it? I know you touched on the dryness a little bit, but these are people who are basically, feel they're debilitated, and patients are asking us every day, when we bring it up about this. So what are your thoughts on that?
I think mental health is a very important area to consider. And if someone is having mental health issues and they're not well managed, then I would not take on anything that can be life changing. It can be even, something for the positive, but I don't know if mentally patients can always handle it. So
Hmm.
I do think that mental health is a big consideration when we're talking to patients, and fortunately, the taboo around that is less, and the care that people are getting is more, and so it's not as much of an obstacle. I think when I started, I mean, this is just to show you how ignorant we were. We used to look, oh, if they're on 2 or 3 medications, like maybe that makes them a non candidate, like psychiatric medications. And now I feel like, okay, like if you're not on those medications and you need to be, that's more of a question.
Yeah.
Um, I remember I once had a patient who had OCD. And he had a great result. And he just called or came in every other day wanting to check on the result again. So I do think that that's a real issue. But
Mhm.
fortunately, people are a little bit more upfront about it, and it's easier to talk to patients about it because it's so well accepted now.
Yeah. And I mean, another big one is dryness as well, right? Like we get a lot of, patients that's the first thing that they think of, right? When they ask us, oh no, but I don't want to have the surgery because I might be dry, right? But I love what you said, because a lot of times we have preoperative dryness, and either it can get a little bit worse or it's the same, but we're more conscious of our eyes. Once we have LASIK, we're more, oh my God, I need to check on it, or oh my God, I feel it, everything we feel, right? So there are a lot of therapies, like you were mentioning, that can manage dryness very well now with optometrists, whether it's radio frequency, IPL, or whatever it is, to address your specific dryness issues. So yeah, I feel like a lot of people don't reach out. And I want to share this. Me and Rhonda had a mutual patient. Who had LASIK many, 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 many years ago and suffered with dryness, but never went to seek help. Right. And that was a huge concern. So, years and years and years later it comes up, and, now we're co-managing her dryness together. But it's important that you seek help if you are having concerns. Like you were saying, someone with mental health issues or someone with OCD should be coming in, and if that's what gives them comfort, right? Or addressing their dryness if that's what's going to make them feel better. And it's important to reach out to either the center or your optometrist, of course. So,
Absolutely. And a lot of those anti-anxiety medications, antidepressant medications cause dryness as well. So, the surgical induced dryness is often thought to be like a 3 to 6 month window. But it's very hard, as we all know, to really understand exactly which contributing factors are creating dryness. And so sometimes just a history of LASIK sort of like people go to that, but it's so much more. It's the medication, it's the air quality, it's the computer time, it's the blepharitis, so it all has to be considered.
well, thank you, Dr. Kersner. That was so much great, great information, and I think helpful for all healthcare professionals. And I'm sure our listeners will benefit, and maybe you'll see them one day at having a consultation with you. So thank you. Thank you, listeners and viewers, for tuning in. If you want to catch more episodes of Uncover Your Eyes, make sure to follow or subscribe on your favorite podcast platform and on YouTube. To learn more about me, follow me on Instagram at dr.Meenal Agarwal. Until next time, keep those eyes uncovered.